Yeah, so the panel will be right here.
Sorry, we made everybody get quiet.
Hi, sorry. Yeah, so here's the front of show. It's on.
Hello, I'm Andrea Cox, and I'd like to welcome everyone to this event, which really marks the beginning of a celebration of 50 years, a half century of phenomenal training of MD PhD students at Johns Hopkins. It is both a celebration and a reflection, an opportunity to think about the tremendous contributions of the program. It was founded by Dr. Paul Talalay, an extraordinary professor and director of the Department of Pharmacology in 1975, and he led the program from 1975 to 1982. And as his children attest, he is the founder of this family-like feel that characterizes the program at present, inviting students to his home and really initiating this program feeling in which we are this big family, and I think that's just an extraordinarily special aspect of our program that continues to this day. We have trained 490 physician scientists since the founding of the program, and they have gone on to do the most extraordinary things. They are advancing the frontiers of knowledge in every possible field of science and medicine. They have provided new innovative diagnostics and life-saving treatments for patients around the world. And they have really become leaders, as was intended when Dr. Talalay founded the program, across the globe in academic institutions and in many other settings that are of great importance to advancing human health around the world. And we have the special pleasure, in addition to having trained decades of phenomenal physician scientists, which is a phenomenal challenge because we all know how difficult it is to do great science or to take great care of patients, and combining those things is really challenging. But the program has, for many decades, 50 years, really helped people to combine both those things seamlessly, to use what physicians know about patients and what researchers can do to advance the state of knowledge together to do maximal good. So I'm fortunate today to have 4 panelists with us, 2 distinguished alumni representing different career paths, but both very impactful, and 2 current students to talk about the current state of the program. The current state of the program remains very strong. We continue to receive over 500 applications a year for the 12 students selected to be part of the program. And they continue to have diverse interests across a broad spectrum of science and medicine, and continue to share the goals of our successful alumni in advancing our understanding of disease and improving human health. The MST, while it continues to thrive and attract top-tier students, is facing some challenges. As I think all of you know, Hopkins is one of the top-tier biomedical research institutions in the nation. And I will say that in our most recent batch of graduates we assessed, they actually had published an average of 10 publications during their PhD, and the majority of them published in some of the most impactful journals that exist in science and medicine. So while the program continues to do amazing things, it is in part that extraordinary success of Johns Hopkins that is now causing it to face some difficulties. Because we are one of the largest recipients of NIH funding in the United States, with approximately $1 billion in funding, that does mark us for the group of people likely to be impacted by the current plans for how to fund biomedical research going forward. So we are remaining completely focused on a curriculum that is rigorous and supports excellence in all scientific and medical disciplines, and we're committed to any changes that may come our way that could contribute to difficulty in achieving this mission in the current environment in which some of the funding that has supported what we do is possibly not going to continue. So as we look forward to the next 50 years, the need for physician scientists has never been greater. We are able to do extraordinary things, and there's been tremendous momentum. And I hope we can continue to move forward in this positive direction and continue to have our graduates and alumni make maximum impact, not just here, but across the globe. So with that, I would like to bring up our panels. And while they're getting up to the front, I'll say that we're taking actions to advocate for our institution, to show the value of higher education and academic medicine, both locally and broadly across the globe. And we are fully expecting to remain a leader in the education of physicians and scientists by enrolling enough students that there's a core and a sense of purpose and community in the MD PhD students here, and by continuing to interact with stellar alumni as we have been doing. So supporting this work through sustained investment, whether through public funding or private philanthropy, is essential to continuing this mission. And I hope that future generations will be able to avail themselves of the extraordinary opportunities our trainees have had since Dr. Talalay founded the program 50 years ago. So as I mentioned, this is the 50th year of the program, founded in 1975, but today is just the beginning of what we plan as multiple celebrations to honor both the program and its contributions. We intend to highlight some of the remarkable contributions of our alumni and current students. That may take another 50 years, but we're going to try and get that done in the next year because they are truly remarkable in all that they have done. And one of the things that I find as the director of the program is that people are constantly saying to me, I met your students, and I wasn't surprised that they're brilliant and driven and passionate, but they're so nice. And that remains true of the program. And I do credit Dr. Talalay with attracting students like that because of really this program where people support one another and are all achieving remarkable goals together. Okay, so I'm going to ask each of the panelists to just take a moment to tell a little bit about yourselves, and then we'll talk a little bit about some of the things that have been impactful in your careers and about your time, either currently or in the past at Hopkins. And we'll start with Dr. Chong.
Yeah. Hi, my name is Raymond Chong. Thanks for having me. It's a real honor to be here for this celebration. So my quick background, I was thinking about this on the way down here. I've been affiliated with Hopkins for almost 30 years, dating all the way back to high school. I grew up locally, and I had the chance to do research under Gary Pasternak, who was an MD PhD graduate from the 1970s. He took a chance on me as an acne-filled teenager at the time. But that's how I got interested in science and medicine. I went to University of Maryland for undergrad, then came to Hopkins for the MD PhD, started in 2002. My PhD was in biomedical engineering under Andrei Levchenko, where I studied systems biology of TNF signaling. I also dabbled in a startup called Uveda Biosciences based off of some of the microfluidic work that I had done during my PhD. During the last year of the program, I was actually applying for faculty positions, but I also got simultaneously recruited to an investment firm where I've been for the last 11 years, called Baker Brothers. We're the largest, oldest biotech-focused investment firm in the world. As I said, I've been there for about 11 years, seen a lot of different companies. I currently sit on the board of Madrigal Pharmaceuticals, which has the first approved drug for MASH, as well as VTB Therapeutics, which is developing drugs for type 1 diabetes.
I'm Shira Ziegler. I started in the fields of science, kind of similar to Raymond. I grew up across the street from the NIH, and so I started working there as a summer student, also with a mentor kind of taking a risk on me. And then went to Ohio for undergrad, then came back to the DC area, worked in the Undiagnosed Diseases program at the NIH before starting the MD PhD program here in 2010. I graduated in 2018. I did my PhD work in Hal Dietz's lab, studying rare disorders of ectopic and vascular calcification. I then switched to finish my clinical training. I trained in both pediatrics and medical and biochemical genetics. And I just joined the faculty last July. So now starting my own lab, still focused on these rare disorders of calcification. I see patients in clinic with inborn errors of metabolism and these rare calcification disorders, and that's what I study in my laboratory. So any interested graduate students, I'm recruiting while we're here. But the MD PhD program has absolutely shaped my career, and I couldn't be more excited to stay here at Hopkins.
Hi, everyone. I'm Rachita Katari. I'm a current student here in the MSTP. Originally grew up in Jersey, but came to Hopkins as an undergrad student. And I had the absolute honor and pleasure to work with Dr. Saul Snyder in his lab as a baby undergrad, and was actually mentored by one of the alum from our program, who first and foremost inspired me to do science and then to pursue the MD PhD. And then, fast forward to when I was applying, and I really thought I was gonna go somewhere else, right? Like I had already built my network here at Hopkins. I needed to go somewhere else, but I just loved it too much here, as Andrea knows. So I stayed on here. I started in 2019, so that makes me a 6th year, which is crazy, in kind of finishing up my PhD. I'm in right now in the lab of Shinzong Dong in neuroscience, studying broadly neuroimmunology, and then hoping to go back to med school soon and also be an alumni someday.
Hi, everyone. My name is Patrick Ndramele. I'm very much so a transplant to Baltimore. So I originally grew up in Kentucky, did my undergrad in Dallas, and then I came here for my MD PhD. I'm about to start my 4th year in the program, halfway through, which is kind of crazy to think about in a way. I study rare genetic eye disorders, and I'm currently in the neuroscience program.
Okay, thank you. So could each of you, maybe we'll just go down the row, talk a little bit about this. Hopkins is known for integrating in the MD PhD program rigorous research and outstanding clinical training. And if you would please talk about how that's impacted your experience here or your current work and how that shaped what you do.
Yeah, so what I do is I spend all my days evaluating biotech companies in terms of the therapies they'd like to develop. These are typically preclinical or maybe they're in early clinical phase. So I am constantly thinking about molecular mechanisms of disease, how the pathophysiology works, how a particular intervention is going to change that or not. Ultimately, what is the degree of clinical benefit that's required to actually make a therapy successful? How are physicians making decisions for a given patient? So I'm thinking through the entire spectrum from literally atoms and molecules, crystal structures, all the way to how things ultimately roll out into the world in health systems. And understanding the entire spectrum is pretty critical because at least for us, we're very long-term oriented. We measure our success in terms of whether or not drugs get approved and actually used and paid for. And so predicting whether that's going to happen and all the different factors that go into that, being sensitive to all those pushes and pulls, that's pretty important for what we do.
I'll just share a vignette that maybe kind of exemplifies how we've been able to combine both the rigorous clinical training and the research. A couple months ago, I heard about a little baby that came to our NICU who had extensive vascular and ectopic calcification and who was in extreme heart failure. And they got a stat genetics consult. You don't always need genetic stat, but it was a stat genetics consult. And they immediately contacted me because they're like, you study vascular calcification. And when I saw the baby, I was like, they have to have one of these conditions that I've been studying for the past 15 years. And like, what are the odds that they're going to show up in our NICU here at Johns Hopkins? We got a rapid exome and was able to confirm the molecular diagnosis. So this baby did end up having one of the disorders that I study. And then kind of with so that's from like the clinical perspective, from the research training, I was very familiar with the space. I knew that there was a drug that was available that I'd actually been involved in working on years prior. There's a startup company called Inozyme that has an enzyme replacement therapy for this baby. And I was able to work amazingly quickly through our IRB process and to get this experimental drug into the baby within the first couple weeks of life. And now the baby, who initially came in with an ejection fraction of 10%, it is now normalized. She's doing a lot better, still in the NICU, but improving. But I think just really exemplifies like how crucial it is to have that physician scientist training to be able to identify these clinical problems, to be able to solve them, and to be able to kind of push our therapies into the clinical space. And I hope that everybody in their careers have that opportunity. I never thought I would be able to, again, just have a patient show up with this calcification disorder and being able to treat it. And honestly, 5 years ago, we wouldn't have had that option because we wouldn't have had that drug into the clinical space. So I think that also highlights how important it is what Raymond does, because it really pushes the drugs so that way we can actually utilize them. Because in academia, it's hard to really push these drugs into the market, but really being able to work together allows us to do so.
Yeah, I think as a current student, it's a little bit maybe harder for me to really answer this question as well, because obviously I'm not in the clinical spectrum or sphere yet. But I think a specific instance that stands out to me is, so my PI is a PhD only, but our lab is quite translational and we work on a lot of different diseases. And he went maybe 2 years ago to a conference and met some clinical faculty at Hopkins, had this interesting question about POTS, came back, slacked me about it. We totally lost contact, forgot about it. And then 3 months ago, I ran into this faculty randomly, and we started talking and realized that a lot of the symptoms that she sees in her patients are actually very relevant to some of the symptoms we see with the receptor we study. And it was just wild how, even as a PhD student right now, I was able to very quickly kind of talk to her and say, hey, why don't we set up this collaboration? If you can get me samples, I can do these experiments now. And literally the next day, she called me and she was like, which building are you on campus? And of course I said PCDB, and she had no idea where that was. So I directed her, and I had the samples in my hand. So that was 24 hours later, after talking to this person, I had an idea about, okay, this is an experiment we can run, which I think is very, very exemplary, not just for MD, PhD, but here I think is very unique to Hopkins, that kind of collaboration.
Yeah, absolutely. So fortunately, I am co-advised by an MD, PhD, and I'm also advised by a PhD only. So my MD PhD advisor, his name is Mandeep Singh, he sees a lot of patients with genetic eye diseases in the clinic. And when we were talking about different ideas for my thesis project, he said, I just met somebody who has this ultra rare genetic eye disease. We're still trying to define the name of it, but I would love for you to meet them. And I was like, okay. And so I get the chance to meet this person and get to know him as a person. I got the chance to meet his fiance. And then I got to explain to him the tenets of the thesis and how we wanted to take his peripheral blood cells, turn those into stem cells, and try to develop a therapy with those stem cells. And the way that his eyes lit up, the disease itself is very progressive, so he can't actually see me, but I could tell that he really was touched, that somebody would spend 4 years of their life trying to cure his specific disease. And I think that kind of represents the idea of what Hopkins is here to do. They want to take patients and give them better options. So.
Those were phenomenal examples. Rashida, you downplayed your ability to cite an example of this, but those were phenomenal examples. Patrick, since you were just finished up, if you and Rashida could tell me, or tell all of us, what were some of the things that surprised you most about Hopkins, either from what you heard and when you arrived, or since you've gotten here?
Yeah, I'd be happy to start. I guess I was surprised about the approachability of everyone here. I remember I was standing at the Daily Grind a couple of weeks ago, and I was just getting some coffee, and then I'm looking at the person ahead of me, and I'm like, that guy looks a lot like Dr. Michael Caterina, who he shared the Nobel Prize for discovering the TRPV1 receptor. And I was like, oh, Dr. Caterina? And he's like, oh, hey, I remember you from class. And then we just had this lovely conversation about how my first year in grad school was going and how I was settling into my lab, while we're both waiting for our cappuccinos, right? And I was like, this guy, I bet if you printed out his resume, it would look like a copy of War and Peace. It'd just be the thickest thing I've ever seen. But he still was so friendly, and he took the time to talk to me. And I think that's pretty representative of a lot of the people here at Hopkins. Very, very accomplished, but also very approachable.
Yeah, I think that's typically my answer, so I'll go with something a little bit different. I think often as MD, PhD, both students, and I'm curious what you guys think as alumni as well, there's this stigma maybe associated with MD, PhD that like, oh, you're not the best doctor, or oh, you're not the best scientist because you're doing both. But something I feel that's very strong here at Hopkins is we have the full freedom to really dive into the program we're doing at the time we're doing it. It's like in preclinicals, I 100% was able to focus on preclinical studying and also talk to different faculty, understand what potential clinical options I was interested in. And then switch to PhD, I have been fully focused on the science and understanding the basic mechanisms, understanding how I can grow as the best scientist I need to be. And I think that's rare because I think a lot of other programs and institutes maybe force you to do both at once always, but I think there really is merit in truly training how to be an excellent physician and an excellent scientist, and only after that can you be really, really a great physician scientist.
Completely agree. Those are really remarkable characteristics of Hopkins. I've personally benefited from them as well. To our alumni, what would you say about the Hopkins MSTP training shaped your career, had the biggest impact on your career?
So the education that, oh, sorry, it's not on. So the education that you get is both general and specific. And it's always very hard to predict exactly which part of the specific stuff ultimately you're going to use. I remember in the first year of medicine, like we're in the anatomy lab, and I think it was Dr. Yang who came by and said, like, you guys need to remember at least half of this, but I can't tell you which half it's going to be. He's a thoracic surgeon, so he remembers everything about the thorax, but does he remember everything, about the limbs? I don't know. But it was very much like that, I think, in terms of what ultimately I end up using. I definitely end up using on a day-to-day basis the general scientific training. I can't tell you the number of times where I'm in a meeting with a company and they're running me through whatever data they've collected, and I have to actively think about, well, what is the next natural experiment that they should be running, or what is the question they haven't addressed yet? And that's not something that you get in a classroom, but you certainly get through the training. But on the flip side, certainly I do need to know a lot about specific things about medicine and about how the body works, and I have to ask those questions in that context. And so I draw upon almost all parts of the training from that aspect. But as I said, it's always interesting and difficult to predict in a given situation what I'm going to draw upon. But overall, I'm drawing upon quite a wide range of things.
Yeah, I think for me, it's about really asking those hard questions and asking those hard questions in the lab, and kind of what's a question that you're interested in that's difficult, that we're trying to really advance knowledge. I think the MD PhD program, again, really kind of emphasizes that kind of need and seeking out curiosity. I think that's huge. And then also kind of asking those hard questions in clinic too. Why aren't these patients getting better? What can we do? For me, I see in patients with inborn errors of metabolism, why is their phenylalanine still so high? What are we not fixing that's causing these metabolic disturbances? And so I think just from the training, really being able to ask those questions and sometimes figure out those inconvenient truths when we get data that might not be consistent with our initial question or our hypotheses. I think the program really sets you up for success to be able to tackle those.
Thank you. And obviously mentorship is a really strong part of the program, both on the clinical side and on the research side. I would love it if you could share examples of how mentorship here shaped either something you've done in the lab or something from your clinical experiences.
I'll start. We'll go in the middle. So I think mentors are hugely important and have been really able to personally launched my career. I mean, I, again, was working in the undiagnosed diseases program. We ended up discovering the gene for this adult onset calcification disorder. And I approached my PI, Hal Dietz, who does not study vascular ectopic calcification, but studies something kind of peripheral to it, and basically convinced him that I should be allowed to join his lab and continue to study my own interest. And he was very receptive to that. And I think he gave me the flexibility and the space and the opportunity to discover my own path and to do the research, and while at the same time being able to really like harness his knowledge of genetics and connective tissue diseases. And I felt like that synergy really allowed me to start building my independent research career. And now, as somebody who's now into, I guess, month 10 of having my own lab, I think he really kind of set me up for success. And so I really appreciate that mentorship and having a mentor who's also a physician scientist to see how to balance that work between seeing patients and doing rigorous basic research.
When I came into the MD PhD program, I was pretty dead set on doing neurology, but I realized during the earlier part of the MD curriculum, while I was in the dissection lab for anatomy, that I wanted to do something more surgical. I still wanted to do something related to neuroscience, but neurology was no longer on the list for me. And so I had a wonderful CAP advisor, Dr. Goldstein, who was like, why don't you look at plastic surgery or maybe neurosurgery, anesthesia? You have so many options. And so I started exploring, peripheral nerve surgery and plastics, anesthesia, looking at different levels of consciousness and things like that. And then I hit ophthalmology. And the people were so nice. Like, they gave me so many snacks. Like, there were so many goldfish all over, and we got to sit down for all of the surgeries, which was great for my back. And I just loved being there. And the intricacies of the eye itself were really beautiful. Like, 1 degree off on one hand could make a world of difference in the surgery itself. And as I started talking to mentors who were ophthalmologists, people like Tom Johnson, Mandeep Singh, I realized there are so many unanswered questions about the retina. Like, when the retina dies, it's a nerve. The photoreceptors don't grow back. And it's outstanding to me that it's 2025 and we still don't have a way to regrow these nerves or give people better options when they lose their vision. And once I kind of caught that bug, I was kind of off to the races for my PhD. So I really think having mentors at those critical moments during my journey made a world of difference and helped me get to something that really makes me get up in the morning. I feel passionate going to work.
I was just going to ask Rachita if you could also, thank you, Patrick, share something that maybe helped you decide how you might integrate your research and clinical interests. What clinical fields appeal based on your research interests, as Patrick so nicely explained?
Yeah, so I guess to answer that question, so I think in terms of research and clinical, it's funny, I came in thinking I was going to do neuroscience. That's what I had done in undergrad. And then I remember the immunology unit, I remember thinking I was going to hate it because there are so many cells, there are so many cytokines. How was I going to remember them all? And sure enough, Bob Silicano was actually my small group leader, and he probably hates me because I would just hound him at the end of each session for like 10 or 15 minutes asking him questions, and I was so just inspired and so excited about immunology, and then that's actually what pushed me to do more of a neuroimmunology type PhD. And then I, in a neuroscience neuroimmunology lab, I thought, okay, great, I will do neurology. But then ended up going to a neuroimmune conference where all of the really cool talks and all of the really awesome people were all actually dermatologists. And I realized that a lot of the really interesting questions, at least that I was interested in neuroimmunology, are at the interface of the skin, right? So how does the environment, how do infections affect the sensory nerves in the skin, and how does that cause disease? So I think something that's really stuck with me through this time is actually like, it's better almost not to plan ahead. Like, I tried and that did not work, but for the better. Like, I'm now finding things that I'm so passionate about that I had no idea I would have if I had kept like a closed mind. So I think that's been very useful.
And you're not just saying that because I'm an immunologist.
Yeah, I promise.
There's a lot of discussion these days on the evolving role of physician scientists in society, and I was hoping each of you could speak to what you see that as and how the Hopkins MSTP helps bridge the gaps between what we want to achieve and how we actually improve care for patients.
I'll go ahead and start. So kind of two thoughts came to mind, also to tie into the mentorship aspect. I have the privilege of being able to monitor a lot of different fields of medicines and diseases. I go to an enormous number of medical conferences every year. And one thing that always strikes me is for any given disease, there's really probably only, call it 5 to 10 physicians in the world who are really pushing forward progress in that particular disease. And it's almost universal, even like big diseases, small diseases, it's always like a small cohort of people. And I just want to impress upon people that you can make a huge difference because like if you're one of those 5 to 10 people, you can have an outsized effect in terms of the progress that you can make. And your ability to mentor people, to join you in that cause and to make progress with you, I think it can be unusually influential. I think it's a little bit underappreciated exactly like how few people it really takes to make a big difference. So now I'm forgetting what what the original question is. But it was tied
Bridging the
into that.
divide between
Oh, right.
science and
Yeah,
medicine
so-
and how integral training.
Yeah,
can
so
be.
so obviously we need a lot of people to be in those academic positions, whether it's a MD or a PhD or MD PhD, to be part of that core group of people who are really pushing things forward. But I also see a lot of people with those kind of trainings who are effectively on the other side trying to make progress, within a company, for instance. And they are often the leaders in the company. They may be chief medical officers. They may be chief executive officers. They may be more on the business side. There's an amazing number of MDs who are finance people now. But if you don't really understand what medicine is about, you can't really be that effective in a biotech company. You really need people with the requisite background in order to fill those leadership roles so that the right decisions can be made, because there's millions and millions of decisions that have to be made during the course of drug development. And not every single one is critical, but like cumulatively, like it's easy to screw something up. And as we all know, most drugs fail. So the more expertise that you can have in those roles, the better. And ultimately, to get at least drug approvals in the US or in the world, you need the money and infrastructure that companies have, whether they're biotech companies or pharma companies. And so we do need people who have that kind of training and background to contribute on that side as well.
Yeah, I mean, I think the dual training really allows you to ask those hard and interesting and clinically relevant questions to see kind of what your patients are experiencing and how we can kind of target disease in interesting and new ways, and then kind of bring those stories into the lab and start investigating them, delineating mechanisms, dissecting out those pathways so that way we can target them for therapies and bring them back to clinic. I mean, I think that's why I did an MD PhD, and I think Hopkins has, again, given me skills in both the clinical world and the research world in order to be able to bridge the gap. But I really think having the dual training is just fundamental to be able to do both. And I'm very new at just starting my faculty position, but I hope that we can kind of continue this forward, and I'm looking forward to training more physician scientists as we move forward.
Yeah, I think there are we all know there are so many different scientific questions in medicine, right? For all patients, whether it's a large cohort of patients or one patient. But really, I think that what I've seen just in myself is like the past 4 years of being a PhD has actually given me confidence to be able to ask the questions. And I think that really only comes from like rigorous scientific PhD training, right? What are the questions to ask and how do you actually pursue the answers? And I think that's why it's really important, because I think as a clinical doctor alone, of course, you can have great and very, very significant research, but I think it's a lot easier with the scientific training to ask those questions. And I think I'm just actually thinking, I see Cassie in the audience here, and we recently went to a conference together, and I remember just after every couple of presentations, we would look at each other and be like, why does that make sense? Like, why did they do this experiment? Why is that better than XYZ experiment? And I think that really shows you, like, the scientific training is what pushes you to ask the hard questions that then pushes medicine forward.
I mean, I would also add to that. I would say that being the bridge between two different worlds means that you're uniquely situated to communicate to the broader world from both of those two perspectives, which is particularly relevant given like the current context in which we live in, where there's a lot of distrust within medicine and there's a lot of distrust within research. And I think MD PhDs are uniquely situated to communicate from both of those perspectives in a way that people can understand. And I've seen through a lot of different conferences here at Hopkins, just people presenting the way that they articulate themselves and how approachable it is truly remarkable. And I feel privileged to be in an environment where whenever the New York Times or the Wall Street Journal wants to find an expert in the field, they typically come to Hopkins and ask that person to explain it to the world. So learning how to communicate from people like that has been remarkable.
I couldn't agree more. So the next thing I'm going to ask is, again, I've mentioned this family-like feel and the supportive environment in the program. Do you have any examples, either from your time when you were in the program or in current times in the program, where you felt that support and that network of the program has really made a difference?
I can go, yeah, like so often. So again, referencing this conference I just went to, I ran into like 4 different alumni from our program that had graduated in the last 5 years, maybe 5 or 6 years. And so I remember them because I was like a bright-eyed M1, M2, and I was like, they're all so cool. And they for sure had no idea who I was. But I went up to them, introduced myself. Oh, I'm Rashida, I'm at Hopkins MSTP. And instantly they were like, wow, like, what are you interested in? What is the research you're doing? Like, please, like, contact me whenever you need. Like, gave me their number and email instantly. And I know that this sounds like, oh, this is probably true everywhere, but I don't think it is. I feel like the Hopkins family really, it goes beyond your time here. And I think kind of going back to one of those earlier questions about mentors, I think one of the strongest things that makes Hopkins so amazing is the casual mentors we have along the way. So a lot of us current students will sit in the MD PhD office and we'll eat lunch or go pick up all our packages because we don't want them to be stolen off of our stoops. And I distinctly remember this moment where I went as a G1 and I ran into DeBebe, who is he graduated 3-4 years ago. He's now at Stanford. Awesome, awesome student. And I was telling about how I was just stressed about grad school, right? Like I wanted to find a project that works. I want to have something successful and work. And he immediately was like, grad school is the only time you can fail. And he was like, remember, you're a student. If nothing works, it doesn't matter because you're a grad student. And that's really stuck with me throughout all of my years as a PhD student, because every time something doesn't work, I'm like, this is what's supposed to happen. That's what DeBebe said. So I feel like that really just highlights the Hopkins community.
I would definitely say that the experience navigating through medicine and PhD as an MD PhD, as we all know, is very unique. And I'd say that I don't know how you guys select for such nice people to be in all of these cohorts, but it is really a godsend.
It's Sharon.
Yeah.
It's Sharon.
She has the magic touch. I don't know. But transitioning from the MD curriculum specifically into the PhD curriculum has been night and day. And just being able to lean on people, like I see Charlie here in the crowd, like we're in the same building. So I oftentimes see him walking in and I'm like, how are your cells doing? He's like, eh. And he's like, how are your cells doing? I'm like, eh. And just little interactions like that really make me feel like I'm not isolated in the challenges of the PhD and that we're all going through something together. I think that my class is a little bit unique in that we all chose very different graduate programs. Some people are in statistics, some people are in neuroscience, BME, you name it. But whenever I run into them on campus, they're always like, oh, hey, how are you doing? And then we end up going on these 10, 15-minute long walks to wherever building they're walking to, catch up on their lives. And we always say, we should hang out again on the weekend. And we go on runs, or we go and we get lunch. So even though it feels like a bit like a diaspora, those connections and that shared kindness that our cohort shares really go a long way. And it's made the transition a lot easier.
Yeah, to echo that, I mean, it's being an MD, PhD, and now as I'm starting my career as a physician scientist, it's hard. It's really hard to bridge both when you're kind of in clinic and then you're thinking about lab, or you're in lab and then you're thinking about your patients. It's kind of disjointed but connected at the same time. And I think to have others, physician scientists that you're surrounded by at so many different levels, I think it makes Hopkins so special. And I have to leave my office like 15 minutes earlier because I run into so many people along the way when I'm walking to my car to go pick up my kids because I just know so many people at Hopkins. Like it really feels like a home. And I have to like take a different route sometimes, honestly, because I'm going to be late. And so but I think like that's why I've stayed, and that's why I don't want to leave, because you just feel so connected and you build these roots. And again, being a physician scientist is hard enough. So like to have that community to kind of support you along the way, I think is just so important.
The thing I always remember from my time is the level of collegiality, and I won't repeat the same stories, so I'll go off on a little bit of a different angle. Obviously, I took a non-traditional path both in terms of the startups that I worked on during the program, but then ultimately where I went after the program. And the amount of support that I got from the program to take these risks and to move off in unusual directions was really amazing. And I remember we were just talking this before the panel. I was part of the cohort where taking step 1 and step 2 became a requirement, so that it could be factored into financial aid requirements or calculations. So I distinctly remember a conversation with the dean. I'm like, so I have to take this, but I don't have to pass. And he kind of smiled at me and said, well, only we're going to know, but we're going to be proud of you anyway. And that I think sums it up in terms of like, there's a lot of ways that you can have an impact. I think people here recognize that. And I got an amazing amount of support for doing something unusual, something very unusual at the time.
And I think the program has really worked hard to make sure that we help people be the best physician scientists they can be, not to carbon copy or clone ourselves, but really help people learn about the path that will be most impactful and allow them to achieve their personal goals. So if I could ask you, just if you, knowing what you know now, what would you tell people who are considering MSTP training and maybe Hopkins MSTP training? Or maybe what do you wish you'd known along the path before you applied, but didn't?
I'll go ahead and start. I think a very common thread for incoming students is the inability to decide whether you like the MD or the PhD more, and the dream of doing both. And you should certainly keep the dream alive, because there are definitely some people who are able to strike a balance and make amazing contributions on both sides. But it is also relatively uncommon. That's the reality. I think most people realize that as they go through the training. And so if you feel like ultimately you do need to make a decision, try to do that or take the steps to make the decision as soon as you can. Reach out to the people that you think can be helpful in informing yourself about what you really like, where you can have the greatest impact, where you want to take your career. I distinctly remember I was probably in the 5th year or something like that. I was buying a used table from someone who turned out to be a 7th year who was about to graduate. So I said, well, what are you going to do? And she said, I still don't know. And I was like, well, I really don't want to put myself in that position. So try not to wait. Really search your soul and gain some clarity on what really matters to you, what you really love, because I think that's really the guiding force in people's lives in terms of how they can be happy and where they can make the biggest contributions if you can gain that clarity as early as possible.
I think my biggest advice is that it's a marathon and not a race. It's a very prolonged training between medical school, PhD, internship, residency, fellowship. It's a lot of training, and I think you have to really just kind of be present and enjoy it along the way. I mean, I'm in my late 30s, I think, and I've just became faculty. My mother was tenured at my age, and so I think that is hard, but I think if you kind of love the process, if you're passionate about just being present in lab and present in clinic and learning everything that you can, I think it just makes it so much better. So you just kind of just be able to just be present in the activities and the research and the work that you're doing at the moment. And there's always a finish line. But honestly, I'm constantly learning, even now, like managing a lab and writing grants and the HR, they never told me that was going to be so hard as a PI. Like, really, guys, come on. But that, I think you're just constantly learning. You just have to, pivot and learn and just kind of enjoy the process along the way, not be so kind of focused on that finish line, but you'll eventually get there.
Yeah, I think because it's a marathon, I feel like the biggest advice that I at least give like incoming students is really surround yourself with the people that'll make you want to come to work every day and do what you're doing every day. I always use this example, but I remember when I was deciding where to go for MSTP, I went to the second look at a couple other programs, and I felt like an average student in their MSTP program. And then here I came to the second look and I felt so below average. Like the people that I met with were insanely smart, but also passionate and excited and had awesome things that they were doing with their lives. And that really made me realize that if I stayed here, I would be just inspired to be the best version of myself. And I don't know that that would have been true had I gone elsewhere. So I think that's really always been my best advice is surround yourself with the people that are going to make you the best version of yourselves.
Absolutely. That was the exact reason I came to Johns Hopkins as well. I stepped on campus and I just felt inspired to do something great. And I felt like the people around me also wanted to do amazing things with their time and with their energy. But also, like, more tangibly, if somebody is applying to the MD PhD program, I didn't realize that every single component of the application process is twice that of like an MD component. Like, you have to write twice the amount of essays, twice the secondaries. The interviews are 2 to 3 days long per institution. I probably would go back and tell myself to get an extra suit, because that one suit that I did had, I wore that thing out. So yeah, I'd give them a heads up.
All right, I'm going to just ask one last question, and then we have the opportunity to have the audience ask. If you can think of maybe one most impactful thing that you had in your MD PhD, or having in your MD PhD experience, and maybe tell us one thing that you really hope, as the program hopefully enters the next 50 years, what you hope for the program to achieve.
To pick up on the theme expressed at the end, my experience, the lab that I was in, the style was to go big or go home, right? Some labs like to put out as many small publications as possible and go for quantity. But the lab that I was in was like, let's aim for the top. Maybe we won't get there, but let's give it a shot. And so, like, learning what it takes to produce the top-notch, highest quality science, that was something that I really got out of the experience. And to your point of students kind of pushing each other to achieve, right? I also, being in that environment, but also being in the general environment, were like, well, all my other MD, PhD classmates, or the classmates that came before me, like, look what they did. Like, can I do that? Can I prove it to myself that I could do that? And ultimately, I was able to, lucky enough to do that. But just the confidence that I took away from that, and the experience of knowing, like, this is what high quality science is, this is what institutions like this are about, that was one of the biggest things that I took away from the experience.
Yeah, I mentioned that the average was 10 publications of students who graduated in the last decade, but actually 65% of them published in Cell Science Nature journals in their PhDs. So they have quantity and quality. Thanks for those comments. Shira?
There was just I was trying to think about like a pivotal moment during my training. I mean, there are just so many. I think it's hard. I think, I think my times in the MD PhD library just kind of is talking to my colleagues and now it's truly my best friends that I still stay in touch with these days, talking at their weddings and like meeting their children, like seeing us just kind of grow together. I think those are just things that just really stick with me. And, my hope is that we can train so many more physician scientists, and trying to encourage them, again, as Dr. Cox was saying, to reach their full potential. Not everybody has to stay in academia. There's so many ways to be a physician scientist, but I think people are, again, so focused on these kind of immediate goals of like, let me get my MD and then, get into the workforce and things like that. And if you kind of just step back and kind of enjoy the process and think about what a great privilege it is to be able to learn this medicine and then go in to ask these questions in lab and have that space and the opportunity to do that. I hope more trainees and students kind of choose that same path, so that way they can just explore their own interests and reach their potential.
Yeah, I think for me, the thing that I've taken most away now and probably later is really just I've mentioned this before, but the connections we've made and the people that I've met. All of the current students and even the alumni that I know so well and who are some of my closest friends are really like people that I believe and know will be pioneers in their field. And I think if I've learned anything from them, it's just follow what you're interested in and you will be successful. I think don't try to plan ahead and just really make sure you're understanding and really pushing the boundaries, and that's how we, end up being physician scientists.
Absolutely. I love how nobody here shies away from complexity. Everyone just dives right in. They want to cure a disease and they're going to do whatever it takes. And the other thing that I really love is that people care about patients. Like, they put patients at the heart of everything, even when they're doing research. And that lights a certain fire that's very easy to notice when you talk to them. They're like, I really care about this niche thing that nobody else talks about, and I'm going to figure it out, and it might take me 20 years, but that's okay because it matters to me. And it's my hope for the program that they'll still cultivate those fires. Like they'll share that fire with new students. Maybe they'll catch it and they'll do amazing things too.
Thank you so much. I'm now happy to take questions if people would like to ask our panelists anything. Even current students don't have any questions.
Don't be shy.
Okay.
Can I ask a question?
Yeah,
To our
yeah.
alumni. What do you both miss the most about being here at Hopkins, and how do you make up for it?
I mean, we talked a lot about the environment, about how comfortable it is to be here. I definitely miss that. I grew up in Maryland myself, so just like not being in Maryland and the weather, the culture, just like the things that make you feel at home. I definitely miss that. You know, I'm kind of anchored in New York City now, so I've made that decision. But I do miss those things, particularly now that I have a family and we're dealing with like, you know, mundane things like school systems and like how do you raise a child and how do you put them in an environment where like it can be equally supportive and familial. Like New York City is not that. So, but like definitely around Hopkins, like it would be a much better place.
Yeah, I feel lucky that I'm still here. You know, I went back to my lab. My office is right next to Hal's office. So I just feel kind of, I'm just like little transplanted right next to it. So it feels so familiar and it feels great. And I think, you know, I used to be able to park at Orleans, and then they moved my parking over to McElderly. So I walk the same path that I used to as a student. And, you know, now that they've ripped off an entire corner of campus, you can see the dome. And I still, you know, it's weird. You still get these tingly feelings when you're walking up the pathway and you see the dome and you're like, I can't believe I'm here. I still feel that way. And I just feel like it's really special to be here, and I feel really lucky. And just again, having the opportunity to really explore these areas, like really dig into like my collection of rare diseases, I think it's a great place. And Hopkins and the MD PhD program has just been so supportive of that. So yeah.
Okay, so Raymond, Shira, Rachita, Patrick, thank you so much for sharing your comments and your experiences. I'll wrap the program up, and hopefully people will come and ask questions, not on mic. So thank you. I will say that I'm not a Hopkins MD PhD program grad. I did my PhD and then came to med school. So please take what I'm about to say in that context. I'm not bragging about myself when I say that the MD PhD students and the graduates are some of the most extraordinary people I've ever met. They have achieved so many incredibly impactful things and have made such a difference. And I think part of that comes from not just the extraordinary researchers we have here, but the extraordinary clinicians and how seamlessly they interact. And so I do feel like Hopkins offers a unique opportunity, virtually unique opportunity, to really engage in top-tier patient care and do top-tier research with people who I think pretty universally feel like this community is the wind in your sails and just helps everyone move forward and, as you said, be the best version of yourself that you can be. And I've been here for decades now and still feel like there's this enormous community supporting. And when you take extraordinary people like the people we bring into the program with this extraordinary kindness that we all see, all willing to help each other achieve maximally, it just produces the most remarkable things. And it really would take 50 years to outline all of the extraordinary things our alumni have done. I mean, I see Drew Pardole here. He's personally changed the standard of cancer care for patients 3 times so far. We expect a little more. But, you know, the list of remarkable alumni and what I see our current students do just continues to take my breath away. So I'm really hopeful that, that this 50 years, really, while we'll celebrate them throughout the year, that this also marks the beginning of a new dawn of continued incredible discovery and just ongoing transformation of the way we deliver care for patients. So as mentioned, we are in a situation in which all top-tier institutions are facing a different landscape in terms of support from the NIH, and I'm really hopeful that we can all work together to maintain this remarkable program and Johns Hopkins in general to support the next generation. If you feel compelled to help us, we do have information on how one can help, but I will say that I think through Kristen Wolf as the immediate contact, I will say that I feel it's a remarkable investment. I do feel, I myself support the program because I feel like we couldn't find a better use of funds than training the next generation of people to continue this remarkable legacy of discovery and transforming the world to make it a better place. So I hope people will come down and chat and spend some time talking, but I truly believe the MD PhD program at Hopkins could not be a more special institution, and I'm so grateful to Dr. Talalay for starting what I think is just the most remarkable program that one could find. So thank you so much for coming. And thank you again to our extraordinary panelists.
Does it work? Does it work? Down, I see. Andrew, could I say one word? Maybe I'll